Good afternoon. My name is Thomas Saya, and I'll talk to you about obesity, the healthcare system in the US, Canada, and Colombia, and similarities differences between the three and how they address obesity. So, obesity is characterized as a disorder involving excessive body fat that increases the risk of health problems. This happens when we consume more than we use. Obesity could cause high blood pressure, type 2 diabetes, and heart disease. And is more often than not, women tend to be more obese than men globally. The US has a mixture of private and public health insurance programs. It does not provide it for everyone, though, and it works through both Medicare and Medicaid. Medicare is for people over 65 years old, whereas Medicaid is for those who are low income and resources, and they are both government-run programs. High obesity rates are across the country in the United States, as can be seen through the picture, especially in the southern states. It's shown to be worsening over time with the busy lifestyles of many Americans across the country, and the US is known to be one of the heaviest countries in the world. Although the healthcare system is very expensive in the US, it does provide a wide range of high quality medical specialists. It also known to have some of the best research institutions in the world. The US healthcare system and the US government spent a lot of money on interventions and policies to try to lower the rates of obesity amongst Americans. And most states have health education curriculum implemented for the youth across the country. The developed country I chose is Canada, which has a decentralized, universal, and publicly funded health system called the Canadian Medicare. It is funded through the tax-paying dollars, and there is also no additional fees for coverage. It is known to be as one of the best in the world, has a very high quality, and people who book appointments will not have to pay any extra fees or deductibles on top of it. This is known as a universal healthcare system. As you can see in the picture right here, Canada has a very high obesity rate. Although it is not the highest, it is on a steady incline since 1970. And it is known to have 30% of total adults are thought to be as obese on average in Canada. Although there's high obesity rates, there are many successes in addressing this problem. Obesity, though, takes up a large portion of healthcare budget in Canada. There are many publicly funded interventions which are mainly community-based. The underdeveloped country I chose is Colombia. The healthcare system operates as a public health insurance plan called Entidades Promotoras de Salud, or better known as EPS. Healthcare in Colombia is seen as very affordable, where nearly 100% of the people in the large four cities are covered. There are also weaknesses in that since there's a large portion of people who live in a rural community, they will not have the best access to it. Obesity has also gone up in Colombia, and this is due to processed foods becoming more and more available over time. And the youth are increasing screen time, which has also played a role to increase the obesity. The healthcare system provides many online education courses, and this is thought to be as help for those who lives in rural communities who are not able to go to normal healthcare obesity clinics. Obesity in all three has also gone up exponentially within the past 20 years. The main goal between the three countries is to increase health literacy. And in all three, the government and the healthcare system are putting a lot of money to lower the rates. There's also seen to be a jump in youth obesity in the last decade. There's been an increase in sedentary lifestyle. Healthcare is also different in all three in that the US focuses mainly on school interventions. The Canada is mainly on group interventions, whereas Colombia is based on health literacy and focusing on the rural communities. There's rising rates of obesity in all three with their long-term effects. Canada and Colombia have universal healthcare coverage, whereas the US has private and public healthcare. It is main focus by the healthcare and the government to lower the rates of obesity.